Ladies and gentlemen, very good to be here. I'm thrilled to be here actually this morning, and I look forward to all the robust conversation we will have about the future of healthcare in this great country. It's great to have these interactions face to face with many of the people here in the room, and this after our collective experience during the last 2 years where everything was virtual. Even as we look towards endemicity, we must acknowledge that COVID-19 has changed our world forever, and there are few areas besides the healthcare sector where the pandemic has had the most impact. Across the world, COVID-19 took a significant toll on patients, healthcare staff, and systems. The pressure that global health systems, providers, and staff had already been facing pre-COVID became unsustainable in some instances. Even now, the pressure on the healthcare industry looks unlikely to abate. Healthcare leaders around the world are thus emerging from the pandemic with a focus on new and existing priorities. According to Philips's 2020 Future Health Index, which polled around 3,000 healthcare leaders across 15 countries, including Indonesia, the most pressing issue facing healthcare leaders is staff satisfaction and retention. A challenging task that in a sector that is facing a wide-scale labor shortage, the industry is facing a human capital crisis. We must move quickly to alleviate burdens faced by many healthcare professionals. Another pressing priority coming from that very study for healthcare leaders is to continue to expand care delivery beyond the hospital walls by investing in technologies such as digital health records, telehealth, and AI tools that enhance efficiency, improve care, and connect remote communities, which is also very relevant for Indonesia itself. Healthcare leaders are building on advances made during the pandemic when telehealth solutions played a critical role in ensuring the continuity of care. The Future Health Index also revealed that healthcare leaders around the world are increasingly unlocking the power of data in both operational and clinical workflows to improve the quality, the cost, and the speed of care. However, challenges remain, as we also heard earlier in earlier presentations. Healthcare leaders continue to be frustrated by the lack of progress in embedding data across the care continuum. The pandemic has demonstrated the value of digital health, ensuring continued patient care. It also has accelerated digital adoption and significantly transformed healthcare delivery. In our view, I think most of us, our view is that digitalization is critical for the adoption of a more sustainable healthcare ecosystem. A digital healthcare ecosystem will significantly improve and expand access to care, especially for underserved communities in remote and hard-to-reach areas. Digital solutions are scalable, which supports the shift away from sick care to prevention and healthy living. Cost per treatment will also decrease, positively impacting the rising cost of healthcare that many countries around the world are grappling with. It is with these goals in mind that the Indonesian government has embarked on a digital transformation of its healthcare system. It recently unveiled a comprehensive digital blueprint as presented by Pak Agus, and lays the groundwork for the country to leverage digital healthcare to provide universal, affordable, equitable quality of care to all Indonesians. Pak Agus Rachmanto, the Deputy Chief Digital Transformation Officer at the Indonesian Minister of Health, will also shortly after me present this blueprint in greater detail. Philips has a deep understanding of the challenges that healthcare leaders face and believe that there are significant opportunities to harness the power of technology to overcome these very challenges. My colleague Megha Kalani will share how Philips partnered with healthcare leaders across the region and the globe to break down these very barriers and complexity to deliver against what we call the quadruple aim, focused on better health outcomes, improved patient and staff experience, and this all at lower cost. Finally, cloud computing is essential to optimizing digital and analytical capabilities across the healthcare spectrum. To really reap the benefits that the cloud can bring, the right policy frameworks must be in place to support the growth of cloud services. Ms. Quint Simon, to the right of me here from AWS, will discuss what policy makers could consider when regulating cloud technologies. The world has fundamentally changed. Healthcare leaders around the world, and here in this very room, are adjusting to a new normal and refocusing priorities to meet the challenges that this new normal brings. I trust that in the next 90 minutes, it will be fruitful as the speakers will share their insights on how digital health technology and innovations could help healthcare leaders navigate these new realities in the healthcare sector. Thank you very much.
Okay, thank you, Vim, for the good introduction. Maybe, ladies and gentlemen, if you can hear my voice, please follow my can. Okay, 1, 2, 3. Okay, thank you. 3 is actual number of years that we have to implement the digital transformation in Indonesia. Is that very ambitious? Yeah. Why not 5? Why not 10 years? If you are curious enough, maybe thanks for this session, so I can give you more context about what we really do to transform the Indonesia digital healthcare. So these sessions, I will share more detail about the blueprint of the digital transformation strategy that we already launched in the end of the 2021. Yeah, this is for the agenda. And then this is the launching of blueprint in digital health transformation strategy 2024 that already launched by the minister itself in December 2021. You can download this by English version or maybe Indonesia version to the website of dto.kemkes.go.id. So please download and learn about this digital transformation roadmap. And about the time. So as I mentioned before, this is a very limited time. So why just until 2024, not 2045 or another time? Since we know that 2024 is a political year for Indonesia, we have to settle this before that happens. So is that possible for us to settle the transformation, a lot of huge homework and also a lot of things to do in just 4 years? So we understand that this is mostly impossible to do, but we know that we have to settle the foundation. So we just target to get the foundation to be settled before 2024. As I mentioned before, we already planned the direction of the transformation by 2021 and bring the book online. And then in the 2022, hopefully this will become the development year that we accomplish the target. So this year could be a lot of regulation launched by the government. One of it is about the digital transformation, and next about the digital electronic medical record. So the decree from the minister will launch mostly maybe in just 2 months. So wait for the decree from the minister about the digital electronic medical record. Also, we discussed with the parliament about the personal data protection law. So this will become the important law, important regulation for us to support the digital transformation in Indonesia, especially for the privacy and managing the data, the record data. Okay, that's about the digital roadmap. And what actually we do. As I mentioned before, we just do the simple diagram. We just want to connect the citizen to the health facility. But how we can connect that? It through the Indonesia Health Services. This is a solution-driven, that precise and also integrated health policy that owned by the government. So in the IHS, maybe the name will be different, because the parliament mandate us to be an Indonesian name, not the English name. So for a while, it will become the IHS, we call it IHS. It connected the entire ecosystem in the health industry. So the main thing of the IHS is it contains the standardization. So we provide the standard with the international standards such as the FL Fire, or maybe other standard like ICD-9 and ICD-10 that already widely used for the hospital. And also the other standard like SNOMED and other standard that we already used before. So this standard will become the national standard, okay? Will become the national standard for the digital interoperability. So we'll be on the IHS. So hopefully in the next year, maybe like in America, they can go to the hospital just by the IHS number. So this will simplify the process in the health facility. Okay, thank you. And what we do is just connecting the citizen health app, which is the Peduli Lindungi transformation, to the IHS. So the patient can get the personal health record from IHS. And the health facility also connect their system into the IHS. So the interoperable will happen in the IHS. So this is the most simple diagram that we can describe in front of you, but there will be a lot of detailed diagram in the blueprint. So we divide this platform actually into eight main cluster. So 7 cluster is about the integration of health industry player, and 1 cluster is about the citizen health app itself. So it's a little bit different. Maybe you have to study about the IHS. This is more detailed. So the IHS architecture can be benefit for the citizen, for the patient, for the hospital, and also for the government. So for the patient, they can get their personal health record directly to their mobile phone. So we created a personal health record that already launched today. It's about the vaccination and immunization. So if you download the Peduli Lindungi right now, maybe you can update the Peduli Lindungi, you can see the immunization record, especially for the children under 5 years. So this is one of sample for the record that already launched in Peduli Lindungi. But next, there will be a lot of things. So if you get diabetes, or maybe you get another hypertension, you will find the different view from your apps. So this will be a benefit for the patient. It also simplify their process to register to the health facility. For the hospital, this will be a good business because when the data is standardized and interoperable, so anyone can go to any hospital. Anyone can go to not only the hospital that record their medical record as long as they share. So they can go to any hospital and they get the last medical record from the IHS. So this will be a good business for the small hospital actually to build the clinic or maybe another other health facility near to the house of the patient. And mostly for the government, they will get this policy-based analysis better. Since we know that when COVID hit us last year, we don't know how we can grab the data from the health facility. It's very scattered, it's very fragmented, and we can do this instead of we have to push them to report in our system. So they do it twice. They report in this, their system, and then they have to input the system to our system. So it will cost a lot of actually in the time of our health worker. Instead of they are serving their patient, so they have to do the reporting. So we understand this thing. So hopefully this solution can be a good solution for the connection between the IHS and also the government and the public sector. So for the industry player, there will be a lot of benefit for them. So they can check the patient, patient, or maybe the doctor. Is it a true doctor or just a fake doctor? Can be, because we have integrated with the health system that we call it as SDMK, SCSMK. Maybe you know all of it about the SCSMK. It verifies the health worker with the true license. So when someone fake the license, so they will notice about this happen. So they, maybe in the HaloDoc or maybe in other telemedicine services, maybe someone can get from the Google, license from the Google, then they can upload that they mention that I am doctor, so I can give the telemedicine service. So if we have the validation process from the ISS, it will be avoided. Okay, so the data standardization as strategy toward the Indonesia One data is really important for implementing this transformation. So actually, we have almost 200 million data from the vaccination itself. So we already vaccinated almost all of the citizens in Indonesia. And all of this data is checked by the Ministry of Home Affairs, by Dukcapil, maybe you know, by the number of the citizens. So this is a very important data. Since this data is collected by the other application, maybe in another application such as BISPK, maybe you know BISPK and other application in Ministry of Health, they collected a lot of data individually. So we try to analyze this data and we try to index this data into one single data that already verified. So hopefully we can have the master patient index that in the next year, you can just get the number from the patient and then you just verify that this patient data is already there. So you don't need to fill all of the data by yourself, by your hospital. So you just need to call the data from the ISS number or maybe the NIC number. So this is the master patient index that can be used for the reducing the patient registration at hospital. So the second data is about the master sarana index or maybe the master facility index. As we know, there are a lot code in the health facility. It's different from the BBGS, different from the Ministry of Health and others. So we need to standardize the code for the health facility. So there will be a standard for the national health facility that already registered in Ministry of Health. So this could be a verification process for the citizen or maybe me as a patient, which facility that already registered formally. So I can choose the health facility from one to others. So the other thing is about the master Nakas index. Nakas is mean the health workers. So this verify all the health worker or maybe the medical worker or maybe the doctor and maybe the nurse and others to one data. So we can verify this can be have a practice in the one place or another place. So we can integrate. If some doctor practice in the one hospital or the two hospital or three hospital, so we can know where he opened the general practice. Okay. And the fourth will be about the data, medical device, and medicines. This is a new standard actually. As you know, the medicine and the medical device is a lot of things we have to describe. So we built this new standard. We call it as a KFA. KF is Kamus, Farmasi, and Alkes. So it's called by KFA. So this Kamus or this dictionary helped by the Directorate of Pharmacy and Medical Device in Ministry of Health. Thank you for the contribution. So they collect this data into one direct dictionary. Hopefully, it will be updated periodically so you can reduce the effort to register all the patient or all the data from the all the data from the patient or maybe from the medical device. So the pharmacy and medical device will be simplified using this standard data national. And yeah, this is maybe the most important about the financing data. So we collaborate closely with the BBGS to make sure that this standard financing data will have the same standard with the BBGS. So hopefully this will become our challenge to connect with the BPJS, but this is already on our roadmap. And the last thing about the service data. The service data is already there since we use the ICD-9 and ICD-10. So it's already knowledge by the health facility in Indonesia. So it will be no problem actually in the service data. So the main challenge is actually in the financing data and also the KFA or maybe the medical device and medicine data. Okay, so this is the standardization of the data that we already try to do in this year. We have a lot of team to do this, collaborate closely with the directorate in the Ministry of Health. So, since the data is already standardized and integrated into IHS, hopefully we can have an interoperable personal health record. So this will be impossible if they are not standardized. So then we can use this data to the driven data policy. So the ministry or maybe the financial government, provincial government can use this data to analyze the condition of the health facility and also health condition in the region. So the quality of health service should be improved by this standard. So this is the main roadmap that we already planned in the blueprint digital health transformation. This is a sample of the dictionary itself. So we call it the dictionary management system. So it already inputted and updated by the Directorate of Pharmacy and also a medical device, and also for by help of our team in Digital Transformation Office. Yeah, this is a sample of the like the dictionary itself. Yeah, so the detail will be within the group and then the member of the group. So it will be so detailed. Okay, one thing about the IHS is it will be useless if you can access the analysis of the data. So we provide the one data or satudata.kemkes.go.id. This will provide for the stakeholder like the provincial government, maybe like the government health office in the provincial or sub-district level, to analyze the condition of the healthcare facility in the region. So this will be provided publicly for public and for private. So it means private, maybe you have to register first before you can get the data. So this is one data at kemkes.go.id. So that's all for the Indonesia Health Services. So for the next, we have the Citizen Health App. So what is the Citizen Health App actually? Yeah, since we know that Peduli Lindungi already become the widest apps that used by the citizen in Indonesia, almost half of Indonesians use this Peduli Lindungi, so we can use to approach as the health services apps. So we have most only maybe 100 million data for the user, so it will be widely coverage the citizen for this apps. So we soon, maybe in this 2 months, we will transform this Peduli Lindungi into Citizen Health App. It could be not a different app, but it with the same name, but the interface will be different. So the feature will be different too. So maybe this is the platform that we call it as Citizen Health App. It's connected for the citizen to the health services through the IHS. And it's collect a lot of things like electronic medical record, health promotion, and especially for the promotion and prevention. So this is very important for them to know what they have to do when they get some sick, or maybe they have something to prevent the sickness. So this is sample of the interview, or this is sample of view for the Citizen Health App. So if you get maybe you get the diabetes, or maybe you get COVID, it will be different view. So if you get COVID, you have to do this. You have to follow this procedure. If you have diabetes, you have to follow this procedure, and also other things. So everyone know if they have connected to the government services, maybe in the public health effort, they will get the notification different from the others. So this is a sample of the Citizen Health App view. we need to intervene the recommendation action for each citizen in the citizen health app. So this is one of case study in child immunization recording actually. So this is already pilot project for BIAN. BIAN is Bulan Imunisasi Anak Nasional. Actually this month, every student have to be immunized, get the shot for immunization. So in Peduli Lindungi, there was new feature that is about the immunization record. So hopefully we can do this not just by the BIAN, but also for the next immunization record. So you don't need to bring the book again. So usually you have to bring the book, Kia book, child and mother book. So you have to bring that to prove that you already immunized. So this will be the digital record for immunization. Okay, last but not least, we know that we can do this alone. Collaboration is a key, so we need to collaborate with the ecosystem. So the last, we are really appreciate the availability and various technology, especially those who use big data, artificial intelligence, Internet of Things, and other machine learning. It will be supported by the Ministry of Health directly. So if you have any initiative, actually this initiative, you can contact us in Digital Transformation Office to get more support for this innovation. And also biotechnology. Biotechnology is one of our things that we are put attention a lot. Okay, but since the technology and transformation arise, we need to ensure that this innovation is comply with the technology. So we need to check the legal and regulatory aspect within the ethic code, and maybe the privacy policy, and also health aspect, and also the technological standard. So we cannot just leap or maybe just do this by ourselves. So we try to build what we call as a regulatory sandbox. This is a place when innovation and innovator in the health sector can pilot their innovation and their business process and monitor by the regulator, the Ministry of Health itself. So they can try their new business process or maybe their new innovation in the safe place, not against the regulation. So this is one that we already prepare for the innovator. And last but not least, we know that a government can be a catalyst for digital health system. So we encourage the collaboration from the health service provider, and then the insurance provider, university, and medical device provider industry, and also the community and also startup to join us to this transformation, especially with these three areas. The first is about the knowledge sharing. We need a lot of knowledge sharing from their innovation. And then the fellowship collaboration, you can join with us in the Digital Transformation Office to collaborate more your innovation in this transformation way. And then the third class about implementation collaboration. This is very important, since we know that we can develop the plan as good as we want, but when you implement something, it's a different way. So we need to collaborate more in the implementation. So this challenge will happen in the 2023 and 2024. So ladies and gentlemen, maybe in this event, I will invite you all to join the Ministry of Health to transform the Indonesia digital services, and hopefully we can synergize each other and collaborate more closely. Thank you for your attention. Yeah.
All right. Good morning, everyone. Thank you, Pim, and thank you, Pak Agus, for also going through the blueprint in more detail. I am Megha Kalani, and I lead the Informatics and Digital Pathology business for APAC at Philips, based here in Singapore. It's my absolute honor to be with everyone today. I would have loved to be there in person, and that was the plan. But as we all know, the pandemic is very dynamic, and I had to change my plans last minute. So thank you for accommodating me remotely. What I wanted to talk about today was basically the fact that Pak Agus mentioned 3 years. Is that enough, let's say? And the answer is yes and no. I wanted to mention that there are many countries around the world and many advanced healthcare systems that still do not have a single patient ID. So in that sense, the work that has already happened in Indonesia in the blueprint and the digital health transformation strategy is pretty commendable. The key challenges that were identified, and I have actually read the 70+ page document in English, talks about these various areas. But what I would like to emphasize, and where Philips can be a partner in that transformation journey, is around these 3 areas specifically. So access to care outside Java, access to comprehensive care across Indonesia, so the equitable element of it, as well as continuum of care for key disease areas, cardiology, neurology, and oncology. Before I go into what that would look like, I think I would like to spend a minute or so talking about what does the hospital of future look like. In order to really understand where we are headed, we need to rethink what the hospital of future looks like. It's not a physical space at all, to be honest. And let me just repeat that. It's not a physical building. Instead, it is a connected network with flexible capability. Now, if you look at it, critically ill patients can be cared for remotely supported ICUs. Yeah, it doesn't have to be in that physical space. Regular care can take place in connected health hubs, and I'm going to talk a little bit about the connected health hubs specifically and more focusing on command centers. What that does is it brings the care closer to the patients within the community, and that goes back to the access of care that I mentioned earlier. An at-risk patient population can be monitored remotely and be more engaged with their health ever before. And Pak Agus referred to that from a diabetes perspective. Let's say the app, the Citizen Health app itself can provide you all that data so you can monitor and be more engaged with your own health as a patient. So how do we envision these connected health hubs or command centers for Indonesia specifically? As Philips, we would recommend 4 command centers, and the rest of my presentation will talk about those 4 command centers. So what would they look like? Cardiology, radiology, and I heard Dr. Lewis talk about that briefly in the stroke side of things, where they are using sort of a command center aspect there as well. Digital pathology, and intensive care. So I want to, for the rest of my presentation, 20 minutes or so, walk you around the world with the examples of each of those 4. So let's start with cardiology. Yeah. In cardiology, we are all well aware that as a patient's cardiovascular disease evolves, the data from a clinical administrative data grows and grows. And now if the patient is seeing different physicians at different locations, whether it's a puskesmas, a general practitioner, a general hospital, or a specialized hospital, it can be completely disconnected. And it's one of the biggest challenges in cardiology around the world. So what if you could have access to all the cardiovascular data of your patient that can be generated from multimodality, multi-vendor? You will see the word multi-vendor a lot in my presentation because we at Philips are very proud and we are very much committed to interoperability from a standards perspective. So it's not about just connecting with the Philips equipment, but it is about following the standards, the HL7 Fire, the XDS standards, the interoperability being a key piece, because we know that that causes the biggest challenges around the world when it comes to digital transformation. So imagine we could have all of that in one single workspace. Now, I said I will take you around the world. So my first case example is from Kingdom of Saudi Arabia. Philips has partnered with Saudi MOH to create a seamless telecardiology network across all of Saudi Arabia. Now, it allows clinicians to share the patient cardiology information between the connected Ministry of Health hospitals. So what you're seeing here is basically 8 cities across Saudi Arabia, with Riyadh being that central command center, and that being the location where all the data is coming together and being read from a teleconsult or telecardiology perspective. Now, this putting it in an Indonesia setting where the specialized healthcare professionals are based usually in Java, becomes very relevant in that sense. So this is, I just wanted to share one example. We have done this before. To what Agus also referred to, implementation is very different from a strategy. We didn't just implement it overnight. We worked with MOH. We co-created what the current state looks like, what the future states look like, and then how do we phase it so that we can one by one bring all of it together. Now, what's very interesting about this example is that it is a federated sort of an example where we're using XDS, which is an industry standard. So hospital A, their satellite hospitals, hospital B, their satellite hospitals, but more importantly, and I talked about the future of hospital being a flexible connected network. So the future hospital groups can also be connected to this very network. So that was a brief example of cardiology. I will switch to from cardiology to radiology now, and I will take us from Saudi Arabia to the United States. So what you'll see here is a very, very novel technique where we have connected hubs in radiology where somebody sitting in a central location can actually look into the exact console of a MR or a CT scanner that could be in a completely different location. Think about it being on a different island altogether. So this machine that you see now is on a different island, but the person who's operating that machine is sitting on a different island. And now, why is this important? I think in multiple ways. So we know that it's less about adding more machines in remote locations, but also making sure that we have the right expertise that can operate a MR or a CT machine in those remote locations. We call this teleacquisition. It is not available in APAC yet, and also not in Indonesia, but I'm sharing an example here. What is very interesting is what I mentioned before. It's not about Philips equipment only. So it can be seamlessly connected to multi-vendors. It doesn't matter as long as those vendors are using international standards. And I think that becomes very, very important. Interoperability is all of our role in that sense as an industry. And what I wanted to also talk about here, I told you we took you to the US. Radiology from a command center or connected hubs perspective is not new. We have seen teleradiology, we have seen telereporting, we have seen teleacquisition is fairly new. So I wanted to bring that example here. And it's not just limited to MR and CT, but can also be done for ultrasound. But the way, if you combine that with advanced visualization and AI algorithms, think about stroke, it can really determine what pathway a particular patient should be taking in the future or immediately, and help triage that from a tele perspective. Here, the example that I showed is more from a US perspective, and here they are talking about using it for distributing expertise. So cardiac imagers on one site can help all cardiology exams across multi-sites, or new technologists can use the expertise of advanced technologists in problematic, let's say, prostate MR, but also centralizing training, which I think is very, very important when we have shortage of healthcare professionals, amplified by burnout that has been caused by the pandemic that we have all witnessed, and you have seen it firsthand live, it really helps with the training and upskilling of our healthcare professionals. Saudi cardiology, radiology US, taking you around the world as I promised, moving to digital pathology. Again, command center approach. What was the biggest challenge here? I'll take you to Spain for a second. The challenge in Spain, the region of Granada, and again, we worked with the Ministry of Health there, was facing that they were unable to efficiently deliver pathology diagnostic services to approximately 1 million of their population, which was spread across 4 lab locations in Granada, Spain. What was implemented is a digital pathology command center with all the 4 labs connected. I don't need to say anything because I think the quote speaks for itself here, that thanks to digital pathology, pathologists that are based in peripheral hospitals in the network can request immediate consultation from the specialized locations where the central lab is. What does that mean? Just if we pause for a second and think about what does immediate consult mean? It's real-time sharing of the image, and it's real-time reading of that image that can really help make a huge, significant difference in diagnosing cancer early. If we were to think of the alternative here, it would be the satellite or the remote labs would have to physically ship the glass slides, put them in a a vehicle, depending on how far it is, sometimes a helicopter, to get that immediate consult. So if you think about the logistical elements, the cost of that we are adding to healthcare and the outcomes there, it is a huge step forward driven by digitalization. And not just that, so the teleconsult piece of it, but the labs itself saw a 21% increased diagnostic capacity on an average. So it's really takes both the operational efficiency as well as the clinical outcomes into play here. All right, last but definitely not least is my fourth example, which talks about intensive care. And during the pandemic, we all saw how important ICUs were, how critically important the staff that works there is, and how being able to separate the staff into a different location from where the COVID patients are can add significant value to the health system and be able to protect the staff that needs to access those patients. Now, the challenge here again, I am taking you now this time to Australia. Lack of specialists to take care of the population from an emergency ICU perspective. And the solution implemented is a central location supporting bedside clinicians with 24/7 monitoring and 1 specialist, and this has been validated across 54 locations in the US as well, that 1 specialist can monitor up to 150 to 200 high acuity patients supported by 3 nurses. So the ratio is 50 to 60 patients per nurse. And why can I say this so confidently is because Philips has worked in remote ICU monitoring space for the last 22 years. And we saw massive expansion since COVID to help create hospital capacity. The numbers that you see here, 30% reduction in length of stay and 26% reduction in mortality, are numbers that have been validated across multi-center, multi-studies. Again, it's a command center approach, so it's a hub and spoke design where we leverage predictive analytics. So it's not happening, you cannot have that kind of a ratio and be able to deliver care if you do not have algorithms, predictive analytic algorithms that are supporting you in that teleconsult. And that's what it basically is that the algorithms help predict it as well as alert the nurses that are remotely accessing it. So in Australia, we implemented Hive, which is health in a virtual environment. In the height of COVID, it was done in less than 6 months and has achieved a reduction of length of stay of 0.46 days across the entire hospital. And we are now expanding that to Western Australia as well. I told you I'll take you around the world, and I did 4 examples, but I also wanted to spend 1 minute talking about the slides. So while we are looking at the command center aspect of it, it can add a lot of value from a digitization, being able to provide access to care and equitable access to healthcare. I think we need to also pause and think about what Agus mentioned about the IHS as well as the Citizen Health app. Because the command centers are more clinically driven, as well as reports of those are generated. They also generate images and scans, if you will. And how do we augment the EMR with what we call a national imaging health record? So it's not necessarily just about the patient data from a lab perspective or a report perspective, but it also has the ability to have a central repository where all the imaging is stored, where we can use a universal viewer that can be embedded within the EMR, HIS, IHS, however that outside needs to be, but it augments the EMR with multimedia in terms of images as well as reports. And it augments whatever patient portal we are looking at from a Citizen Health app perspective specifically. So this is happening closer home. So where I'm sitting in that location, we are in that process working with the government here as well. And that is something that we should also look at in parallel when we talk about that. That was my journey around the world, and I ended it in Singapore. And I would like to now hand it to the team to play a quick video of what the future could look like from a connected health space perspective. So can we cue the video in? And terima kasih, and thank you for listening to me.
Selamat pagi, good morning. It is a true privilege to be here among this esteemed audience today. Hello, my name is Quint Simon, and I lead the public policy team for Asia Pacific and Japan for Amazon Web Services. My team of policy experts across the region are responsible for working with governments as they define policy roadmaps, develop policy guidelines, implementing decrees and regulations in order to support the digitization journey across all sectors of society. The company I work for, as I said, is Amazon Web Services. And you might be thinking to yourself, why is AWS speaking at an event that is focused on healthcare and healthcare outcomes? To answer that, I'll talk quickly about what AWS is, what cloud computing is, and what role we see ourselves having in supporting Indonesia's healthcare digital blueprint. So cloud computing, as many of you will know, refers to the on-demand delivery of IT services over the internet based on pay-as-you-go pricing. And sorry, I'm just working out the slides. Thank you. Via pay-as-you-go pricing. You may have heard in the news, organizations of all shapes and sizes are moving to adopt cloud services, cloud computing. There are a few reasons for why we're seeing this incredible transformation and adoption of cloud services across the planet, from organizations as government agencies, banks, fintechs, startups, and increasingly healthcare institutions across the planet. The 4 key reasons. The first is cost. Prior to the advent of cloud computing, organizations had to pay upfront for the servers, the CapEx costs associated with running their IT platforms. With the cloud, it is no longer the responsibility of organizations to buy servers and essentially have to predict how much server capacity you're going to need a year from now, 2 years from now, 6 months from now. If the pandemic taught us anything, it is about how unpredictable our world is and how important it is to be elastic and quick and nimble in response. So the second main reason we're seeing organizations, especially healthcare institutions, move to the cloud is the agility, the ability to scale up and down in a matter of minutes. Think about the contact tracing platforms. Think about the vaccination rollouts that occurred over the last 2 years. The fact that cloud enabled the scaling up of those from 0 to hundreds of thousands of people within a matter of days really shows the transformative nature of this infinite scalability that comes with cloud. The third point is security and cybersecurity. As we all know, there are nation-state actors as well as criminals intent on harnessing the data that is relevant to healthcare institutions in order to cause damage. The fact that by shifting to a cloud environment, every organization is inheriting a set of security controls that meet the requirements of the most highly sensitive organizations on the planet. Think militaries, intelligence agencies. All of that security is fundamentally baked in to the cloud from day one. And the last point is related to innovation, and I'll go to my next slide here. A lot of people, when they think of cloud, we think of iCloud. So we think of, data storage, basic data processing. And that was true, years ago when AWS was first established in 2006. But today, the cloud is so much more. The best way to think about the cloud is really the platform that enables the most advanced services on the planet to be able to be offered to any organization on the planet who would benefit from them. So as you can see from the list here today, some of the technologies that Agus spoke about in terms of big data analytics, artificial intelligence, machine learning, those all fundamentally are built on a public cloud environment. And the reason for that is that these types of services rely on the ability to collect, analyze, aggregate vast amounts of data based on algorithms and data sets that are already built into the public cloud. So for us, being able to basically build these services and offer them at the same price for any customer on the planet who would benefit from them really demonstrates the transformative nature of the cloud and what it can bring to the societies in which we operate. So let's talk a little bit about healthcare. As I mentioned, especially since the pandemic, we have seen healthcare organizations of all shapes and sizes start their digital transformation journeys by leveraging the cloud. But it's been really interesting for us to watch as we've really seen the transition occur in 3 major steps. The first is what we would consider basic IT cloud transformation. So this is really migrating on-premise, siloed, isolated workloads onto the public cloud in order to benefit from the cost, the agility, the security, and the innovative potential that I mentioned before. So that's really step 1 in the journey. The second stage is taking advantage of some of the more advanced solutions and technologies that are available on the public cloud. And that's really where we talk about artificial intelligence, machine learning, cybersecurity tools, and others that can help move from, as our colleague previously said, reactive and treatment-based diseases to predicting healthcare relevant trends and ultimately delivering better outcomes in patient care. Then the last stage is really about using the tools at the disposal on cloud to personalize that healthcare journey. And that was one of the main standouts of Pak Agus's presentation on the healthcare blueprint for Indonesia. This focus on every person having their own healthcare needs, their own healthcare journey. So the ability to use that power of big data analytics, but then to personalize it for every citizen of the country, that is really the vision for what cloud can ultimately help enable from a digital transformation perspective. Now, AWS is deeply committed to supporting our customers, partners, and ultimately countries with these healthcare blueprints. From our perspective, we're working with numerous SaaS providers, integrated software vendors, partners, and customers to develop healthcare-specific tools that are available on the cloud. And you'll see here on the slide just a list of the tools that are available today on the AWS cloud in terms of services and solution areas that can support our customers and partners in the transformation journey. I will happily share the website afterwards that contains all of the list of solution areas that are available in this space. So that's all really great in theory, but what about in practice? We've talked a lot today about COVID-19 and its impact. COVID-19 at the beginning of the pandemic exposed some of the fundamental gaps in every healthcare system in the world. We saw the impact of data silos. We saw the impact of lack of information exchange. We saw the impact of lack of interoperable standards. And all of that really prevented, or at least radically slowed down, the ability for us to launch solutions and tools to deal with the quickly evolving pandemic. The wonderful thing that, if there is any silver lining to the pandemic, it has been the incredible digital transformation that it unleashed, which has the power to help us in the long term. And I just want to touch on a couple of case studies of some of the governments and companies in this region that really moved quickly to embrace this opportunity to transform the way they were doing things previously. So in Australia, New South Wales Health were one of the first to move to telemedicine. And they were able to, by using the cloud, shift and increase the amount of telemedicine happening 18-fold within a matter of weeks. With regards to vaccinations, AWS was honored to support numerous vaccination rollouts across the planet. In Singapore, where I'm based, IHIS, which is the Integrated Health Information System there, used AWS to shift from 8,000 vaccinations a day to 80,000 per day in a span of 4 weeks. Moderna itself, as everyone knows here, a key provider of vaccines across the world, actually built its mRNA vaccines on the AWS cloud. And what's really exciting now is we are seeing customers from all across the globe take the lessons of the pandemic to help prevent future pandemics. So the University of British Columbia in Canada, they have used supercomputers that run on AWS to identify, and this is a bit scary, 130,000 new mRNA viruses in 2 weeks for the cost of $24,000 US. In the past, that would have taken 2,000 years to run that level of analysis and be completely cost prohibitive given the level of data analytics required to be able to predict virus dimensions into the future. Now let's talk a little bit about Indonesia. And before I do, I want to speak briefly about AWS's commitment to Indonesia and our partnership with the government here. As I hope many of you know, AWS launched our data centers in Indonesia in December last year, in December 2021. And this was a major investment. It's not a small number of racks and servers. We chose to bring to Indonesia the biggest investment that we can make anywhere on the planet, which is a full AWS region. AWS regions are comprised of multiple clusters of data centers. In fact, 3 clusters of data centers, which enables fault tolerance and redundancy. That means that if there is ever a natural disaster, for example, that impacts one of our clusters of data centers, data is able to fail over to the other 2 clusters of data centers that we have here in Indonesia. For us, having a commitment to the reliability and availability of data, which is extremely important in a healthcare scenario, was extremely important. Our investment is expected to deliver 71 million rupiah of benefits over the next 71 trillion rupiah of benefits over the next 15 years and annually. Now, one of the reasons that we came here is because we wanted to work even more closely with our customers and partners who were already using AWS services here in Indonesia. And at this point, I would love to touch on this example of Halodoc. Halodoc, as many of you know, is a startup that is now growing very quickly that is aimed at providing telemedicine and other healthcare services to the people of Indonesia. When the pandemic broke out in 2020, Halodoc and AWS partnered extremely quickly to figure out how Halodoc could be a solution provider and ultimately support the issues faced in the pandemic. Halodoc, with their partnership with AWS, were ultimately able to reduce storage costs by over 70%, build a data lake within 6 months, manage a data pipeline with just 3 engineers, create data pipelines in 2 hours instead of 2 weeks, deliver data queries in just a few seconds, and gain insights into supply chain. Most importantly, we were able to work with Halodoc to partner in the communities that were deeply impacted by the COVID pandemic. So in Karawang, for example, in West Java, over 80% of people were impacted by job losses or displacement due to the pandemic. And we were able to work with Halodoc as well as the government in Karawang to open temporary vaccination centers and to distribute grocery kits in Indonesia in order to deal with the worst of the crisis. Now let's talk a little bit about the policy implications. How do we get more Halodoc stories? How do we get more success stories? How do we get more lessons learned from the pandemic? It really does come down to having that enabling policy and regulatory environment for the adoption of the most advanced services. And at this point, I absolutely want to commend Indonesia for the Blueprint for Digital Health Strategy 2024. As I think several of our colleagues have commented, it offers such an incredible opportunity for Indonesia to leapfrog many of its neighbors, many advanced countries around the globe in delivering healthcare outcomes for citizens. In our experience, there are a number of basic principles that are required in order to develop a really effective policy framework to underpin an ambitious digital healthcare strategy of this magnitude. On the slide, you'll see several of the recommendations that come forward, but I just want to touch on a few of them. The first is that last one, actually, empowering citizen access and control of data. There is a common misconception about cloud that when you put your data on the cloud, you don't really know who owns it, you're not quite sure where it is. That is actually not the case. In an AWS environment, it is 100% our customers who own and control their data. They choose where to put their data, they choose where to store their data, and they choose what security and privacy controls to match with the sensitivity of the data sets. So that control is entirely in the hands of our customers in Indonesia. And now with our local data centers, our customers have the ability to store and process all of those key data sets within the territory of Indonesia. The other point I'll make is that risk-based regulation that balances privacy and security concerns. We heard from Pak Agus, his work with the parliament in understanding the status of Indonesia's privacy bill, data protection bill. And it's extremely important to ensure that privacy is at the heart of any digital healthcare blueprint. However, the really key thing to take away here is that security, privacy, and innovation are not mutually exclusive. At this point, there are so many regulatory best practices that balance all three of these critical constraints in ways that still enable those healthcare outcomes and those really ambitious goals that were articulated in the digital blueprint for Indonesia. I would also echo my colleague from Philips in terms of calling for interoperable standards, international-based standards. This is extremely critical for ensuring that the customers and partners and everyone is able to participate in that ecosystem of healthcare in Indonesia and across the world. And that ultimately what is done here in Indonesia, what is innovated here, is able to be exported to the region and ultimately globally. You'll see a number of other policy recommendations on the screen as well. A nationally connected data architecture is well underway already. That connection of data being incentivized is extremely important. That focus on being able to use the advanced technologies like AI, ML, perhaps in the context of a regulatory sandbox, is a wonderful idea. But ultimately ensuring that we're focused on healthcare outcomes and patient outcomes by balancing, again, those core concepts of privacy, security, and innovation. I want to, at this point your attention to a really interesting report that was published by Access Health and AWS Institute, which is our internal thought leadership platform, called Barriers to Cloud Adoption for Public Healthcare in Asia Pacific. To conduct this study, Access Health interviewed a number of government officials, healthcare providers, and citizens across the region in order to really determine what is the barrier for public healthcare and cloud in the Asia Pacific region. And I won't spend too much time reading into this because I think, number one, Access Health really found a lot of similarities in our views in terms of the overall benefits that cloud can bring to the economies in the Asia Pacific region. We've talked a lot about how it can really transform the role that patients play, healthcare organizations have, and ultimately have transformative impact on health systems. But interestingly, the Access Health team also found some key recommendations for Indonesia, and I'll just quickly touch on those at this point. So, number one, many countries across the region, including Indonesia, have established cloud-first policies in some way. And these are really policies that direct government agencies to choose cloud because of all of those benefits that we talked about at the beginning. The challenge that we're finding is that unless those cloud-first policies explicitly talk about the role of cloud, it becomes very confusing for the industry, for healthcare players, for hospitals to know exactly what the policy is. And I think in Indonesia's case, the extent to which the National Healthcare Blueprint can continue to emphasize the role of cloud in underpinning all of these technologies, the more clear hospitals, organizations, and the ecosystem operating in this space will be in terms of what they can and they cannot do. We talked about the importance of using a range of policy tools. So absolutely, there is a role for national level legislation, for example, in the privacy space. We heard Pak Agus talk about the fact that there's going to be regulations specifically for digital transformation and electronic medical records. Those have their place in the ecosystem. Sandboxes are an incredibly effective tool to use in order to incentivize and really spur adoption of new technologies. So sort of piecing those pieces together in a puzzle box and ensuring that all of those strategies and tools are used to create that enabling ecosystem will be really beneficial for Indonesia. The data governance piece is specifically important. So data governance is a broad concept, right? It includes questions around cybersecurity, it includes questions around privacy and data protection, international standards, business continuity. The really important thing is to ensure, again, that balance between the different trade-offs in the ecosystem. So security, privacy, data governance, all of that can exist together. And I will say that there are, within Indonesia, but certainly in neighboring countries, there are great policy best practices to choose from in terms of how other governments have balanced these various needs and specifically brought in privacy and data governance into their policy frameworks. Again, my colleague at Philips talked about the importance of interoperability, and I want to echo that again. International standards, the ability to ensure that connected data is connected within Indonesia, and then ultimately Indonesia can be connected to the rest of the world, is going to be incredibly important for a long-term healthcare system that is connected to the planet. Really investing in that foundational ICT ecosystem as well. For AWS, I've talked a lot about the fact that we, of course, have our local data centers here, but we also have our network of customers and partners who are innovating solutions for Indonesia and finding ways both fiscally and from a regulatory perspective to incentivize those experiments can be very transformational. And then lastly, and this is perhaps a theme that we should touch on more during the panel session, is skills. Skills can be the #1 barrier to the adoption of the most advanced digital technologies. And this Access Health report certainly found that in Indonesia, similar to every other country in this region, we are not going to be able to succeed on that transformation journey unless we equip every public servant, every hospital, every healthcare organization with the basic skills to be able to really live in that digitally connected future and use those advanced technologies. Thank you so much for your time today and from hearing from me about the role that AWS plays today and is hoping to play in the future for Indonesia, as well as our policy recommendations for Indonesia based on this research by Access Health. I appreciate your time. Thank you so much.
And just a reminder, if you have any questions for any of our panelists, you can go to slido.com, that's slido.com, key in the event code DHI2022, and you can submit your questions for our panelists here. All right, but maybe let's kick off with a question for Pak Agus. You know, was there any part of today's presentations by Megha and Quint that really resonated with you?
Yeah, it's very insightful actually. So we learned a lot from other countries to implement the digital transformation, and especially how we can implement the national health record. So as Megha mentioned before, that it's not just a record that already transformed from the labs or maybe from the health facility to the citizen, but it also need to more advanced, that look like the imaging data and other data that we need to transform it into the simple way that the policy analyst can inform that, and maybe the citizen can knowledge what they have to do. So this will be a good learning curve for us, and hopefully we can collaborate together in this year or maybe in the next 2 years within all of the colleagues from the international sector. So this will be good for us to change. Thank you.
All right, thank you, Pak Agus. Now, you know, Philips is a global brand helping healthcare systems worldwide and has helped to advance their digitalization strategies. Megha, what would you say are the key factors to success that apply across all these healthcare systems?
Yeah, thank you for the question. And before I go there, Pak Agus, I completely agree. Let's go deeper into what that next level of implementation could look like. From my experience and from the experiences we have had across the world, I think what is one thing that is common is that there is no one size fits all. We are in a very complex digital ecosystem, and the country dynamics really complicate it further. The demographic, the population spread, the diseases that are more prevalent. And I think what is really beneficial is bringing all the stakeholders on the same level. And I think in that sense, the blueprint really starts to establish that stakeholder alignment across the various, let's say, healthcare professionals as well as MOH. If we look at a particular example of, let's say, a command center or something, there are complex workflows as well as clinician demands and patient demands that could work in that particular ecosystem that need to be understood, that need to be heard from the very beginning so that everyone is bought in and feels that this is their transformation. It's not something that is being top down, we have to deal with it, because the adoption of those top down are very low compared to when we have all the stakeholders in the room. So I think that, in my view, is critical, and Quint mentioned earlier we should touch upon that, it's the skills as well. So I think those two, in my view, are absolutely critical, and this is where partnering with the right partners to establish that common ground, what the future state looks like, and how we can stepwise work on that co-creating that with the industry partners can really help take it to the next level of success.
Thank you, Megha. All right, Quint, we've heard from Pak Agus earlier about the vision that he outlined for Indonesia's MOH. But what can the Indonesian government do to deliver on that vision?
Thank you so much. So, we've talked at length today about the really amazing vision that the Indonesian government has for healthcare here in Indonesia. It's truly inspiring. My colleague from Philips was just talking about how the ecosystem needs to come together in order to implement and deliver the solutions that are going to make this beautiful vision a reality. And I would say that's equally true from the policy side. I think there is a wonderful vision here for an ecosystem of players across government, private sector, startups, state-owned enterprises, big organizations, and the extent to which the policy development can also involve these critical stakeholder groups to ensure in the implementing regulations and in the details of the policy development that it really does align and drive ultimately those wonderful outcomes that are envisioned here. So to the extent that there is multi-stakeholder process to bring the various voices together and, as my colleague said, to really co-create those solutions, I think that will be a key factor for the outcomes. Certainly from our perspective, Indonesia also does have the opportunity to continue learning from its neighbors and ultimately leapfrog, as we were saying before the event. But really, to whatever role AWS can play in bringing together those stakeholders and bringing together those lessons learned, we've had the incredible opportunity to really see different countries in this region in particular both do some really amazing things in driving that digital policy journey, but also we've seen quite a number of missteps. And so to the extent that we can support and share policy practices and ensure that Indonesia learns from all the wonderful examples out there, but also avoids some of the missteps that have come both before and since the pandemic, we'd be really honored to play that role.
Thank you, Quint. We've got some questions from the audience. Just let me read it out here. So what is the plan to make sure that all stakeholders in the healthcare ecosystem have good technology literacy? So perhaps, Pak Agus, you want to take that? And Megha, later you can add on to that.
Yeah, as Quint mentioned before, that the health literacy is very important, especially for the capacity building for the persons. So we try to migrate, maybe we try to just acknowledge them that the transformation is needed for this year, but they don't see the need for the transformation actually. So we have to literate, especially for the healthcare practitioner, or maybe the healthcare people, that this have to do now, not in the next year or not in the next 2 years, because if we don't do this today, we maybe not have a chance as good as this year to do the transformation. So the literacy is very important, and hopefully it can be spread not across the Ministry of Health, but also for the citizen of Indonesia. Thank you.
Thank you. Megha, do you want to add on to that? I mean, you worked with many...
Yeah. I would love to. I think for me, it's two things, right? So we are talking about healthcare professionals, irrespective of their titles, wanting to adopt technology. I think one first thing would be what's in it for them. So if we can showcase the value that we are adding to their life, right, to their personal life, the buy-in element becomes very important. And the second, and I think most critical piece of it, is to ensure that we have the right training programs, that we set the right support system and don't just leave, let's say, implement and then leave the teams to figure it out by themselves. It needs to be a stepwise process. And I think that is where, again, we can really help because we have the experiences that we have learned of what has worked and what has not worked before to not make the same mistakes again. Quint, I see you nodding. Would you like to add anything to that?
Thank you so much. I mean, I fully echo your comments there, and I would just say that for AWS as an investor in Indonesia, we take our responsibility seriously to not just bring physical infrastructure and physical capital, but also be a champion of human capital development and the skills and training programs. Certainly for us, we have, we're not going to be experts in healthcare in the way that many of you in this room are today and my co-panelists are. But what we can bring is really that the skills training with regards to some of that underlying technology that we talked about, right? So if it's AI or if it's machine learning or big data analytics, that's really where this beautiful marriage of healthcare and technology come together. And so, we certainly have a number of training programs in Indonesia, both for civil servants, which I know many of you here are today, but also for schools, for NGOs, and for the average person to really increase that digital literacy and ultimately be able to use those advanced tools that are at our disposal. So again, another partnership opportunity.
Thank you, Quint. All right, we've got another question from the audience. It's from Dr. Prabhu, and it's for Megha, actually. He asked, why is it that not a single country has integrated all services together? Cardiology in one country, radiology in another. So, what are your thoughts on that?
Yeah, good question. It has been always a way of, let's say, prioritizing budgets. If we take a step back, I think departments and hospitals were set up with departmental mindset, and depending on which department was getting the budget first, it was driven from that perspective. That has changed, and I think the silver lining of the pandemic, if there is any, as Quint mentioned, is that the transformation is breaking the silos of departments. We are starting to look at, and we are seeing healthcare institutions, governments across the world looking at it from a patient lens. It doesn't matter if it's cardiology, it doesn't matter if it's radiology. It's about diseases, pathway informatics, how do we drive better care for that particular patient, including genomics and DNA, and going into precision medicine with the big data ability to drive that. Now, are we there yet? No. And that's why you still see examples of one from one country and second from the other. But there are countries, and I can share that more offline as well, where it's starting to come together more from a multi-ology, or as I said, enterprise imaging, where it is one archive for all ology data, and then the reports which look at multi-data points to get to the report or the diagnosis, then the report sits on top of that. And Singapore is driving towards that, as I mentioned as well. So I can share more offline, but don't want to take up all the time here. But yes, it's headed in that direction.
Thank you, Megha. All right, Pim mentioned in his opening address that a recent survey found that the most pressing issue facing healthcare leaders is staff satisfaction and retention. So perhaps it's a challenging task in a sector that's already facing, widespread labor shortage, especially when it comes to nurses, right? So how do you think the digitalization of the healthcare system can help improve this aspect of staff satisfaction and retention? Pak Agus, maybe you want to start with that?
Yeah. This is a good question, but maybe it's a little bit difficult to answer. Yeah, since the fulfillment of the health worker is very different in each country, actually. We acknowledge them as well as we know how can we help to fulfill their needs and also to efficiency their working procedure. So we need to listen more. So we need to listen to the health worker and also for the health management that already come here today. We really appreciate if you can share more about your needs or maybe your concern in the digital transformation. So it will not be the top-down approach, as Megha already mentioned before, we hope that it will be bottom up, and also all of the innovation is collected from all the nation. So this will become the movement of the nation. So this happened when we realized that COVID already get us a huge hit, maybe, yeah. But since we heard and also we try to transform this as soon as possible, hopefully this become the next movement of healthcare in Indonesia. Thank you.
Thank you, Pak Agus. Megha, Quint, would you like to add on to that? No? Okay, I think we've more or less come to the end of this session. But I think in closing, I'd like to say that, as the digital healthcare ecosystem in Indonesia continues to evolve to provide universal, affordable, and accessible care, quality care for all Indonesians, healthcare leaders like many of you in this room will find yourself having to face new and very sometimes daunting challenges. But with the right partner, that journey can be made easier. Right? Because as healthcare systems accelerate their transformation towards the future, technologies such as AI or the cloud or IoT and other digital capabilities will prove crucial in enabling more healthcare providers to deliver more personal, more accessible and more dynamic patient care. And I think the impact that this will have on communities in remote and hard to reach areas will be revolutionary. All right, and with that, I'd like to thank our panelists, that's Pak Agus, Quint, and Megha, for joining us today and sharing their thoughts and their insights. So please, everyone, give them a round of applause as they make their way up the stage.